H-Card, Healthcare Access Research and Developmental Disabilities. A talk about health. Atlas on the primary care of adults with developmental disabilities in Ontario. In 2013, the H-Card program wrote a book called The Atlas on the Primary Care of Adults with Developmental Disabilities in Ontario. This book had a lot of information about how healthy people with developmental disabilities are in Ontario and the kind of health care that they get. This video shows Dr. Yona Lunsky explain some of what the H-Card team learned and wrote about in their book to a group of adults with developmental disabilities and their families. You can watch this whole video at once, or you can watch it in sections. It might be a good idea to watch each section and talk about what you learned and what it means to you. Part 1. What this talk is about. So what are we going to talk about today? We're going to talk about things we do to feel healthy, and we're also going to talk about things we do and how sometimes we might feel sick. And we're going to talk a lot about how doctors and nurses work with us when we're not feeling well. Now, there are all different places we might go to see the doctor. Some people, I don't know if anyone here has done this, but some people, sometimes when they're not feeling well, the doctor actually comes right to your house, or a nurse might come to your house if you need to get some bandages removed or things like that. So it might be in your home. And it might be that you go and you have an appointment at a doctor's office. And sometimes, like Maureen was mentioning before, you might have to go for an emergency to the hospital. And sometimes you might even stay overnight and be in a hospital for a longer time, right? So those are all different ways that you can work with doctors and nurses to deal with your health. Now, there are rules, and sometimes we call these rules guidelines about how we're supposed to take care of our health. So we have our own rules, and also doctors and nurses have rules or guidelines about what they're supposed to do. So can you see the first picture, what's happening there?
Yeah.
What's he doing?
He's brushing his teeth.
That's right. So there's a rule. I have a rule, and I use this rule with my kids too, that they should brush their teeth every day in the morning and before they go to bed. That's a healthcare rule, right? It's good to do that because then you don't get cavities. Another rule is that if you're bleeding or you've got a cut, probably a good idea to do what? Yes, what's in the picture? What do you put on a cut?
Band-Aid.
Exactly, because it keeps it clean, it stops it from getting infected. So those are like guidelines or rules about health. But doctors and nurses also have rules that they follow about health care. So we're going to talk about those rules today. Part 2. How healthy are people with developmental disabilities? So let's talk first of all about how healthy we're learning about people. Now I could go and I could ask everybody, are you healthy? Are you healthy? Are you healthy? But there are so many people with developmental disabilities who live in our province. It's a huge province. Do you know how many people live in this province? More than 13 million people. So how long would it take me to go talk to all those people and ask them how healthy they are? Take a very long time, right?
Right.
So what we're doing is we're looking at their information that's sort of in a giant sort of, I guess, computer. Every time we go to the doctor, some information gets recorded and it's sort of in this big computer and we can find out about that information. So I'm talking now about the health of a lot of people, about 66,000 adults, that's a lot of people, and how healthy they are, okay? So for example, we learned information about how common diabetes is for people who have developmental disabilities. Diabetes is something where your blood sugar, it doesn't make you feel right and you might get kind of shaky because of what's happening with your blood sugar, and the insulin in your body isn't doing what it's supposed to, and it can lead to a lot of problems. So one thing we learned here is that on the red side, it says if you have a disability like a developmental disability, you see all those blue people? Those are all the people with developmental disabilities. So out of 100 people, 10 people with developmental disabilities. Not all those people. Most of the people in black don't have diabetes, but the people in the top line, they do have diabetes. Now, if we look at the other side, if we look at people who don't have developmental disabilities, do we have as many blue people? No, so we have less diabetes if you don't have a disability than if you do. So that's one thing we learned about how healthy people are, is that we see more diabetes. And we also see, does anyone know like what it would be like to have a heart problem? So it could be having a heart attack or just having a heart that's not very healthy. And we see here that actually there aren't really any big differences between if you do have a disability on the red side or if you don't have a disability on the green side. Okay, so about 15 out of every 100 people have a problem with their heart. Now what about having problems like asthma or different kinds of breathing problems, respiratory problems, where it's hard to get the right kind of clean air so you feel good when you're breathing? We also learned that that can be a big problem for people with disabilities. So if we look over here, we see more people with asthma who have developmental disabilities. Okay, so more diabetes problems, more breathing or asthma problems for people with developmental disabilities. Now what about when you feel just kind of down or like depressed or really anxious and it's hard to do things? So we call those kinds of things mental health problems, where just you don't feel quite right in your head. And sometimes you might need to take medication for that, or you might need to talk to somebody about it because you don't feel good about what's going on, and you're maybe really confused, or your memory's not working right. So we call those kinds of things different kinds of mental health problems that people might have. Okay? And what we see here, look at all the blue. So we see that mental health problems are actually, there's more blue people in these pictures than the earlier pictures, both if you have or if you don't have a disability. But we see that the problems are bigger for people with disabilities. More people who are feeling really unhappy, or really anxious, or maybe just being like their behavior is just they're having a lot of difficulties doing what they're supposed to do. And they're just not feeling well inside their feelings and in their thoughts. Okay? So this is telling us that some people, not everybody, but some people with disabilities have a lot of different kinds of health problems. And sometimes they have more health problems than people who don't have disabilities. And some people in this room, all of us, take medications. And sometimes we might just take aspirin because we're not feeling well. And some people might just take 1 or 2 medications a day. Some people might take 3 or 4. And some people might take 10 medications a day. And we're not counting things like vitamins and calcium. We're talking about medications that a doctor has to write a prescription for you, and you go to the drugstore and you get those medications. Could be for, remember I said there's diabetes, so it could be a medicine for diabetes. Could be a medicine because you're feeling really unhappy and sad and it helps you feel better. It could be a medicine for if you have seizures and you don't want to have a seizure, you might take those medications. So all different types of medications. So we were able to look at how many people with developmental disabilities take maybe no meds or just 1 medication. It looks like about half of the people, like maybe half the people in this room or half the people in Ontario who have these disabilities aren't really taking a lot of medication at all. Okay? But there are some people, so it's about 1 in every 4 people. If we went around this room, 1 in every 4 people with a disability are taking between 2 and maybe 5 medications every day. And there are some people, maybe 1 in every 5 people in this room, could be taking like 8 or 9 or 10 medications every single day. Okay? But we do know that people who have these disabilities we're talking about, that they're taking more medications than other people, which tells me that they need to be able to see their doctors and nurses and get good health care, right? Because they have health problems. Part 3. What kind of health care do people with developmental disabilities get? So the next part of the presentation is I just want to talk a little bit about where and when people see doctors who have disabilities. See all the blue? That tells us that most people, if you have a disability or if you don't have a disability, all the blue people are the people who see their doctor at least once in a year. So that's good news, right? Everybody's going to see their doctor, almost everybody. I worry about the people at the bottom in the black because they're not seeing their doctor at least once a year, right? And I think it's really important for people to see their doctors once a year. But most people are going at least once a year, okay? Now this next slide is showing us about not going to your doctor at a regular appointment, but having an emergency when you go to the emergency department. And what we see here is that there are more people with disabilities who have emergencies and have to go to the hospital than if you don't have a disability. Okay? So in a year, almost 1 in 3 people with disabilities goes to the emergency department for something. And we also want to see who actually stays overnight in a hospital, who goes to the emergency department and maybe has to have a surgery or have tests on them, or they have like needles or something, and they stay in the hospital at least for 1 night. And what we see here is, again, not very many people stay in the hospital. Most of the people in black, that means they're not going to the hospital. So people with disabilities, more likely to go to the emergency room and more likely to stay overnight in the hospital. Okay? So that tells us that if there were 100 people in this room, 8 of them would go to the hospital. Part 4. Healthcare guidelines or rules. You only remember one thing from today. One of the most important things from our project and one of the most important things we want to put in our book is about going and getting a full checkup once a year. It's really, really important for everybody, but it's especially important if you have a disability and you might have different kinds of health problems or more health problems than other people. You want to make sure you're going every year just to make sure you're healthy, okay? 22 out of 100 people went to their doctor, and we actually looked, we said over 2 years, who had a checkup, at least one full checkup in a 2-year period. And only about 1 out of 5 people went, okay? And that's not good enough. Because we know, and we've learned this from Australia, we learned this from the UK, we were even learning this from places in the US. People have shown that if you have a disability and you go to your doctor once a year for that checkup, it can make a really big difference in terms of picking up those small problems before they're big problems to make people healthy. And we don't see people going enough to their doctors, okay? And in fact, people who don't have disabilities, who might have not as many health problems, they actually go more than people with disabilities. So remember I showed you before how many people went to see the doctor at least once? And most people went at least once, but not for the checkup, right? They went because they had a very bad cough, or they went because they broke their arm, or they went because they're feeling dizzy. But they didn't just go to check out how they're doing. And that's something that's really, really important. When you get older, if you're a woman, you're supposed to go, this is another one of those rules or guidelines, you're supposed to go to get a mammogram to check for breast cancer, okay? If you have breast cancer, it's like a tiny little lump that you have in your breast. And at first when it's really small, nobody sees it, nobody feels it. But if it grows and it gets really big, then the cancer could make you feel very sick. So we're supposed to go get a mammogram. And it's like taking a picture almost and figuring out what's going on inside the breast in case there are any lumps in the breast. So how many women who are older get this kind of mammogram compared to women who don't have disabilities? If you're a woman and you're 50 or older and you don't have a disability, you're going to get a mammogram more than women who do have disabilities. Okay, so that means that if you have cancer and you have a disability, we might not find out early enough, right? So that's a big problem. So we also have the same results when we look at another kind of cancer that women can get, which is called cervical cancer. So sometimes you have to get what's called a pap smear if you're a woman, and women who have disabilities are less likely to have that tested also. And then this is looking at colon cancer. Colon cancer is the kind of cancer you can get, again, more when you're older. So when you go to the bathroom, you have a number 2, they take a look at that and they see if it's got any problems in it related to cancer. Or they actually do a procedure where they actually look up inside your bum and check out what's going on. Okay, so that's what you do to check for colon cancer. And what we saw is that if you have a disability, there aren't as many blue people, right? That means not as many people with disabilities are being checked for colon cancer as people who don't have disabilities. Okay? And that's a real problem because, again, if we don't check it, then we don't know. That's something we want to change. Okay. Now, here's a good news story. So if you have diabetes, one of the rules is that you're supposed to have your eyes checked every year. It's very important because one thing that can happen if you have diabetes is you can get problems with your vision. You can even lose your vision. So if you have a disability, you are actually more likely to have your eyes checked than people who don't if you have diabetes. So that's a good news story. If, on the other hand, you fall down and you have a little bone break, not a very big bone break, but a little bone break, it could mean that there's something wrong with your bones, and that's why your bone broke, because it was just a little fall. You shouldn't have a break, right? So you're supposed to have a test called a bone mineral density test, but they just kind of check out what's going on with your bones to see if you're starting to have a problem with your bones. And if there is, there's things we would do to make it better. It could be because you're starting to get osteoporosis, and there's things we want to do about that. It could be related. Calcium is a really good thing that we would take to help us, but sometimes there's some medicines that people take, especially if you have seizures and things, medicines that actually make you more likely to get bone problems. So people with disabilities might be more likely to get those kinds of bone problems. And so we looked, if you fall down and you have a break, are you likely to go back to the doctor and get this bone mineral density screening? If you have a disability, you're less likely to have that follow-up than if you don't. Okay, so even though we're doing a good job with the eye exams if you have diabetes, if you have other kinds of health problems, we might not be doing as good a job. And this last one is showing, it's a bit of a complicated one, but there's some times where we go to the hospital for a problem that if we were seeing our doctor regularly, we should be able to not have to go to the hospital for it. So for example, constipation, when you really, really can't go to the bathroom and it's very, very uncomfortable, that's not something you usually go to the hospital for, right? You just watch what you're eating, you drink a lot of water, maybe you get a massage, or maybe you have an enema or something, but you don't usually go to the hospital because of that. But sometimes if you're not getting good care, you might go to the hospital for it. And diabetes also, you don't usually have to stay in the hospital overnight because of diabetes. You should be able to take care of it at home. But sometimes you do have to go to the hospital. Most people with developmental disabilities do not go to the hospital for these problems, but there are more people with developmental disabilities who are going to the hospital for those kinds of problems. So again, that's telling us that we're not doing a good enough job with these regular checkups and taking care of health problems when they're small. So sometimes they get really big and people have to go to the hospital. So what do you take from this? What did you learn today? What is this telling you? We should be prepared if we have to go to the hospital, or even if we just have a doctor's appointment, we should have really good information about ourselves that we can share. The time to have to give all those explanations is not when you're feeling sick, right? So how can we have all the information ready for people about what medications we're taking and our health problems so we can show it to somebody when we're sick, even if we can't talk about it very easily, right? So they can understand it. Hearing this, if we were to talk to other families or other people with disabilities, like what would we tell them? What are you learning today that you think we should be telling people? So one thing we've learned is that if you see the same doctor regularly and you see them a bunch of times, those people who see the same doctor a bunch of times are less likely to go to the emergency department than if you have a disability and you see different doctors. So it's not just important to go to a doctor. You want your doctor to know you really well when you're healthy as well as when you're sick. So what do we need to be telling staff? And what do we need to tell the doctors and the nurses? Has anyone else had that experience that the doctor, if you have a disability, that the doctor might not have patience or wait to talk to you when you ask a question? Like when they ask you something that maybe they just talk to your staff, or they don't wait for you to say what you're feeling? Sometimes the doctors might not have the time, and they may not know, like if they're just booking in 10 minutes, maybe to really listen carefully they need more than 10 minutes. But if they got another patient coming right away, they don't have any more time. So the doctors need to learn to book more time so they can listen carefully. There are some really excellent tools that have been developed to help primary care providers, if they're doctors or nurses, family doctors, to help them do their jobs with patients who have different kinds of disabilities. And there are ways that these things can be done. And so it's important that we share that information with families, and also that we share information like that with doctors. It's not as simple as just go to the doctor. Sometimes if you go to the doctor and you're really, really nervous about being with a doctor, you're not going to have a very good appointment. Remember I showed at the beginning pictures of sometimes doctors coming to the house? So it may be that sometimes a doctor has to take that one exam and split it up into different pieces, and maybe they don't do the exam in the regular doctor's appointment at the office. Maybe they do a home visit, or they do a couple. And maybe over time we can teach even people who are very, 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 very nervous or upset about doctors. They can learn over time to get used to doing different kinds of procedures. So not everything has to be done when people are sleeping. But that takes a really good partnership, doesn't it, between the patient and the doctor. If you can't get to the doctor, then either the doctor has to come to you, or you need to get some kind of helper or case manager, someone to help you get to the doctors, right? So we need to make sure for people who are more alone that they have that kind of help.
Key messages. Everyone's health is important. Doctors and nurses need information and help to keep us healthy. Everyone, from different doctors' offices, the hospital, and other places where we get help in the community, needs to be better at talking with each other and working together. Working with doctors and nurses to take care of our health is our job too, so we need help to do that better. By working together, we can help everyone to be healthier. If you want more information about what we talked about in this video, please go to our website at www.hcard.ca. HCARD's partners in the creation of this book include the Ontario Ministry of Community and Social Services, the Ontario Ministry of Health and Long-Term Care, Surrey Place Centre, the University of Ontario Institute of Technology, the University of Ottawa, and Queen's University, as well as ISIS and CAMH. HCARD was funded for this work by the Partnerships for Health System Improvement Program of the Canadian Institutes of Health Research. The opinions, results, and conclusions reported in this study are those of the authors and are independent from the funding sources. No endorsement by the Institute for Clinical Evaluative Sciences, the Centre for Addiction and Mental Health, the Ontario Ministry of Community and Social Services, or the Ontario Ministry of Health and Long-Term Care is intended or should be inferred.